Hi everyone, I'm Aerik Kunju. I'm a biology and public health student at Nova Southeastern University. Thanks for being here. Today I'm going to talk about how psychedelic-assisted therapies may help us address not just addiction itself, but also some of the deeper underlying issues that fuel it, particularly trauma and spiritual disconnection. This isn't just a look at one substance or one study, it's a broader story about how we may shift the way we view recovery. So let's dive in. Addiction is often framed as a chemical issue or as a matter of bad choices, but that framing is limited. It treats substance use as the main problem, when for many people, it's actually more of a symptom. What's really going on underneath that behavior? Research shows that for a lot of people struggling with addiction, the real drivers are things like unresolved trauma, chronic stress, or a deep sense of emptiness and disconnection. So if we really want to support recovery and not just suppress behavior, we have to start there. So one of the clearest patterns in addiction treatment is and addiction research is the high rate of trauma among people with substance use disorders. This includes childhood adversity, violence, grief, and all kinds of psychological injury. These experiences alter how the brain processes reward and stress, leaving people more vulnerable to seeking relief through substances. At the same time, addiction often coincides with spiritual disconnection, not necessarily in a religious sense, but in the sense of being unmoored, disconnected from meaning, purpose, or even from oneself. When you combine trauma and spiritual emptiness, substances can seem like the solution, but over time, that coping mechanism can spiral into a full-blown disaster. So here's where it all ties together. Trauma, addiction, and spiritual disconnection don't exist in isolation. They reinforce each other. Trauma can lead someone to seek relief through drugs or alcohol, and that use can deepen spiritual disconnection, making people feel numb, disconnected, or ashamed. And addiction itself often creates more trauma through broken relationships, unsafe situations, or just the experience of losing control over your life. This result is kind of a feedback loop. And the longer someone is stuck in that loop, the harder it is to climb out of it with traditional tools alone. That's where psychedelic therapy comes in, because it has the potential to disrupt the cycle at multiple points. Psychedelics don't just target behavior, they go deeper. They open up this mental space where people can actually face the stuff they buried for years: trauma, grief, disconnection, and they can start to process it. People describe it like gaining perspective they've never had before. And that can be a turning point, not just for quitting a substance, but for rebuilding a sense of self. That's why I think they're so powerful. They don't just treat the symptom, they help people reconnect with the part of themselves that hurts. So let's talk about the neurological effects of psychedelics and how they may allow for therapeutic breakthroughs that we've been talking about. You'll often hear about the default mode network, or DMN. That's a key network in the brain associated with our sense of self, and it tends to be overactive in depression, PTSD, and addiction. Psychedelics like psilocybin disrupt that network, allowing for different brain regions to communicate more freely. The Rebus model, short for relaxed beliefs under psychedelics, suggests that psychedelics can open us up to new ways of seeing ourselves and the world. Different psychedelics work in different ways. Classic psychedelics are 5-HT2A serotonin receptor agonists. Ketamine works on the glutamate system through NMDA antagonism, and MDMA facilitates emotional processing and bonding. But what they share is the ability to increase neuroplasticity, emotional insight, and introspection, which is especially valuable when trauma has locked someone into a defensive or disconnected mindset. So, as I said, classic psychedelics, including psilocybin and LSD, primarily act on serotonin 5-HT2A receptors, which affects how the brain communicates internally. You'll notice the fMRI image on the left. Under psilocybin, there's increased crosstalk between regions of the brain compared to more compartmentalized activity in a normal state. And this disruption of rigid networks like the default mode network is thought to allow for new psychological flexibility. People under these substances often experience emotional breakthroughs or mystical type experiences that feel deeply meaningful. This may help people reframe trauma, gain perspective, or access parts of themselves that they've avoided. Neuroplasticity is enhanced, which supports long-term psychological change. Now let's talk about ketamine, which works quite differently from the classic psychedelics. Ketamine is an NMDA receptor antagonist, meaning it influences the glutamate system, which is the brain's main excitatory neurotransmitter system involved with learning. So this modulation creates a glutamate surge, leading to increased neuroplasticity. This means ketamine can help the brain rewire itself, break out of old patterns of thought and behavior. And this is particularly valuable in addiction, where ruminative or self-destructive patterns are deeply ingrained. So, uh, clinically, clinically, ketamine has been shown to be effective in treatment-resistant depression and increasingly effective in addiction settings. It's also used often in psychedelic therapy because of its shorter duration and legal accessibility. And while it doesn't typically induce the same type of mystical experiences as psilocybin or LSD, it often enables a detached and reflective state, sometimes described as observing yourself from a distance, that can help uncover insights about one's behavior and traumas. MDMA is distinct from the other substances we've discussed because it's not a classic psychedelic. It's a phenethylamine and an entactogen. So it enhances emotional openness and social connection and reduces fear, especially around traumatic memories. In clinical studies like the phase 3 trial published in Nature Medicine in 2021, MDMA assisted therapy showed significant reductions in PTSD symptoms compared to placebo. And that's with patients who had treatment-resistant PTSD. So, for people with addiction, especially when trauma is a driving factor, that emotional openness is powerful. It helps people actually face what they've been avoiding, and often with a therapist who can guide them through it. Studies have also emphasized how MDMA helps build trust, which is especially important for people who've experienced interpersonal trauma. So MDMA may not treat addiction directly in a pharmacological sense, but by treating the trauma that fuels addiction, it may help indirectly by healing what's underneath. Now let's talk about ibogaine. It's one of the lesser known psychedelics, but stands out because of its profound anti-addictive properties. Ibogaine is derived from the root bark of the African plant Tabernanthe iboga, traditionally used in spiritual ceremonies in Gabon. So clinically, ibogaine appears to interrupt substance dependence, especially for opioids. Patients often report that after a single session, they've experienced not only a reduced cravings, but also a complete disruption of withdrawal symptoms. This is incredibly rare, particularly with opioid use disorder, where withdrawal is typically intense and persistent. However, ibogaine isn't without serious risks. It can affect heart rhythm and cause neurotoxic effects in high doses, and it's also illegal in many places, and most of the current data comes from observational studies or underground treatment centers. That said, there's enough promise here that researchers are calling for controlled trials and safer delivery mechanisms. Even if ibogaine never becomes a mainstream clinical treatment, studying how it works can inform safer drug development. To me, ibogaine represents that edge of psychedelic science where promise and risk are in constant tension. But it also underscores a key idea in this talk, which is that we can't ignore tools just because they don't fit the mold. Healing addiction means rethinking what we thought we knew. We've been focusing in on the link between trauma and addiction, but we also need to acknowledge that addiction rarely exists in isolation. It often co occurs with PTSD, depression, anxiety, or even chronic pain. Some people have multiple substance use disorders or also struggle with behavioral addictions like gambling or compulsive eating. This complexity is what makes treatment so hard because you're not just treating the substance use, you're treating a person who may be using substances to cope with a wide range of suffering. One of the promising aspects of psychedelic assisted therapies is that it doesn't narrowly just target one symptom. Studies have shown benefits across multiple domains: mood, trauma symptoms, substance use behavior, and even existential distress. So the challenge here is designing models that can handle that complexity without oversimplifying it. And that's where integrative and trauma-informed approaches become essential. What happens when someone loses touch with their sense of self or their place in the world? Well, trauma can do that. It disrupts self-cohesion and emotional processing. and addiction often follows, becoming a substitute for connection, regulation, or purpose. Psychedelic assisted therapy can serve as a bridge back to the self. We've seen in studies that psychedelics like psilocybin and MDMA can reactivate parts of the brain that support emotional openness, social connection, and cognitive flexibility. This isn't just about biology, it's about making meaning. People report that feeling reconnected with the emo People report feeling reconnected with emotions they haven't accessed in years, and they describe these experiences as deeply healing because they help them remember who they are beyond the pain and patterns of addiction. Now we're getting into something that really stands out in the research, the role of mystical experience. Across studies, we see that these profound, often spiritual states that emerge during psychedelic therapy are strongly tied to better outcomes. One of the most notable examples is the study by Dr. Johnson at Johns Hopkins in 2016. They worked with people struggling with tobacco addiction and found that those who had what was called a complete mystical experience, which was measured by a validated scale called the MEQ30, were far more likely to be abstinent at follow-up. This experience includes feelings of unity, transcendence of time and space, a deep sense of sacredness, and ineffability. And it turns out it's not just a fascinating subjective phenomenon, it's predictive. It seems to help people reframe their relationship with trauma, find deeper meaning, and get that perspective shift that leads to behavioral change. Further studies specifically on spirituality and recovery, reinforce these findings. Uh, there, these are two separate teams, one focused on addiction, the other on spirituality, yet they both point to the mystical experience as being central to healing. And to be clear, this isn't about promoting any religion, but it's about acknowledging that for many people, the most transformative aspects of psychedelic therapy have to do with reconnecting to something larger than themselves and something they lost along the way, whether due to trauma, addiction, or both. So, this phrase, spiritus contra spiritum, comes from a powerful letter that psychiatrist and psychotherapist Carl Jung wrote to Bill Wilson, the co founder of Alcoholics Anonymous. Young had been treating a patient who was actually a Rhode Island state senator, and he told Bill W. that he saw his patient's craving for alcohol was really a misplaced spiritual thirst. He wrote that the Latin word for alcohol, spiritus, could be countered only by another form of spirit, or spiritus contra spiritum. A spiritual experience is crucial to counter addiction to the spirits. And the 12 steps in AA were actually created with this idea in mind, that recovery requires surrender, transformation, and spiritual connection. Um, what's fascinating is that modern studies of psychedelics for addiction treatment are landing on the same insights. Many participants describe a sense of reunion, healing, or deep insight into themselves or the universe. These aren't always framed as religious, but they're often described as spiritual. They help restore a lost sense of purpose or meaning, and that can be a crucial shift for someone trying to escape the grip of addiction. This doesn't mean that everyone needs a mystical experience to recover, but it raises the possibility that psychedelics might offer a path to reconnection that some people can't find in traditional programs alone. Okay, so now let's talk about what happens after the psychedelic experience. A big part of making these experiences therapeutic isn't just what happens in the session, but what happens after, and that's called integration. Integration is about taking the insights or emotional breakthroughs and turning them into real life change. That could mean new boundaries, new habits, or just being able to make sense of what you experienced. But integration also isn't just about journaling or talking it out. It's also about ethics. We're dealing with powerful psychological material here, so having a therapist or guide who's trained, ethical, and trauma informed is really important. We've seen cases where lack of proper ethics or preparation led to harm, and that's the exact opposite of what we want. There's also growing conversation about how to responsibly include indigenous knowledge. A lot of these substances have been used in ceremonial or spiritual settings for centuries. So part of ethical use today means being humble, being culturally aware, and knowing the difference between appropriation and learning. Ultimately, psychedelics can open a door, but it's the support, reflection, and ethical container that really makes the difference in whether people heal. So if we zoom out, what does all this mean for the future of recovery? I think it means that we need to reframe addiction not as a moral failure or even just as a disease, but as a complex response to unresolved trauma and disconnection. Psychedelic therapies aren't a magic bullet, but they do offer something that many treatments don't: the chance to reconnect people with what they've lost, whether that's emotional clarity, a sense of meaning, or connection to others. This future also calls for broader access. We're still in a phase where only a select few can afford or access these treatments. And if this is going to be a part of recovery for more people, we need models that are scalable, safe, and culturally competent, not just medically effective. And another piece I think is often overlooked is how important integration is, not just as a phase after a psychedelic experience, but as an ongoing process of making meaning in life. Integration means asking, what does this mean for my life, over and over again? And we need recovery systems that hold space for that. And finally, this future is about blending and not replacing traditional clinical care with the community-based spiritual and cultural dimensions that actually make people feel seen. If we can bridge that gap, I think we'll get a lot closer to healing that is real and lasting. All right, so just to bring it all together, addiction, as we've explored, is not just about the drug. It's a downstream symptom of upstream problems. Trauma that hasn't been processed and a spiritual disconnection that leaves people feeling unanchored. These issues reinforce each other, forming a cycle that is really hard to escape from with surface level treatments. What makes psychedelic therapy so powerful is that it doesn't just reduce symptoms, it goes straight to the roots. It allows people to revisit and reframe their trauma, sometimes for the first time, and it can reconnect people to a sense of meaning, purpose, or something larger than themselves. When that happens, the need to escape through substances often falls away naturally. This model, healing trauma, reigniting spirit, and addressing substance use holistically, is what I believe recovery can look like when we allow ourselves to treat the whole person. And psychedelic therapy may be one of the few tools capable of supporting that kind of integrative convergent healing. Thank you all so much for listening. A huge thanks to my psychedelics team, Hannah, Naomi, and Leander, and to all the mentors and researchers who've made this work possible, and to all of you for being here and being open to this conversation. Thank you again.